Hey there, my name is Leonard. I'm student number 334546 and this is my AVMA task video for Clinical Pathology 1, VTHT 2223-31420. Okay. So I'm going to demonstrate how to run a chemistry panel. So first thing we're going to do is we're going to put it in our computer system. So we use AVMA here at our hospital. So I've got my patient pulled up. It's Snickers by Lusky. I'm going to hit F2 to add a charge, and my code for the panel is an AWS. I'm going to make sure I select our correct doctor, which is Dr. Purdue, and then hit enter. That puts our requisition in, and that's going to send it all the way over here to our IDEX vet lab station. So now I'm going to select my patient. I'm going to hit run, and I'm going to be running it on our Catalyst 1, so make sure I select that and run. I'm going to go ahead and open that up. I'm going to discard of any previous samples in there. I'm going to give it a couple little swirls to invert it. Remove our lid. I'm going to go ahead. We're going to be running a Chem 10. So I'm going to go ahead and open that. Slide that in there. So to make sure that none of the slides stick together. And then I also make sure I have all my pipettes full. So I'm going to go ahead and top that off. We're going to close it, hit the start button, and then we'll come back. It's going to give us a countdown here. It's going to take about 8 minutes. We'll come back when that's done, and we'll read the results. Okay, so our results just popped out of the printer, so we're going to go over those really quick. So it looks like pretty much everything is within the normal value, within the normal range. Our glucose, creatinine, BUN, we checked our total proteins, albumin, globulins, ALT. Our alcohol is reading slightly low. However, we actually don't ever trust that on our machine when it runs low. We actually have a list that we keep that our IDEX rep actually told us to go ahead and keep track of, just because it's been reading low on almost every patient. So we actually don't want to trust that value. And so all in all, I would call this a good and normal reading. Okay, so today I'm going to be demonstrating how to perform an ELISA test. ELISA stands for Enzyme-Linked Immunoabsorbent Assay, and what that does is that's going to check for things like bacteria, viruses, hormonal changes, parasites, and so that's what we're going to check for today. I'm going to be running an IDEX SNAP 40X Plus, and this is going to check for Lyme disease, anaplasmosis, Ehrlichia, and the heart rate antigen. So we're going to open up our package, take out our test, and we're going to use the supplied pipette to go ahead and take 3 drops of serum. We're going to place that in the supplied vial. 1, 2, 3. And then we're going to take 4 drops of the conjugate that came with the sample. 4, there we go. All right, now we're going to put our top on, invert it, and then we're going to pour it into the well. And then we're going to wait for this fluid to travel up through the window, and as soon as it hits the activation window, we're going to go ahead and snap it, and that's going to activate the test. As soon as we see it hit that little window, we're going to snap it. All right, there it goes. So we're going to snap, we're going to set our timer for 8 minutes, and then we'll come back as soon as that timer goes off, and we'll check and see our results. Okay, so our timer just went off. That means our snap test is complete. And if you look closely here at our results, this is a negative result. So this little dot right here is our control, and that means that our test did work accurately. However, there are no other dots that appeared, so it means that this pet is negative for these parasites. Okay, so I'm going to demonstrate how to do a heartworm test via direct smear. So you're going to make sure you have all of your necessary supplies. This is going to be a microscope slide, some cover slips, a little pipette, and of course your anticoagulated blood. So the first thing you're going to do is you're going to go ahead and invert your blood a couple times. Make sure it's definitely not clotted, it looks good. And then we are going to take our slide. We're going to put 1 little drop on our slide. Here we go. Go. And then we're going to take a cover slip, place that directly on top, like so. Here we go. So there's our sample. We're going to place it on our microscope, and we're going to read it under the 10 times objective. I'm going to go ahead and get this all set so I can see it. that's nice and in view. And so I'm going to be scrolling around looking for microfilariae. So what that's going to look like is, I like to describe it as invisible snakes. So we're going to see them squiggling all around if they do have some. And this is a sample from a heartworm positive dog that is actually in the middle of heartworm treatment right now. So I'm unsure if I'm going to find a sample or not. But I'm going to make sure that I go up and down throughout the entire slide to make sure I fully cover the entirety of the cover slip. So I'm going to go down, over, up, over, down, over, up, over the entire way, and see if we come across any microfilariae. And if you do not come across any microfilariae, it's always a good idea to just have somebody double check behind you, just to confirm that there in fact were not any, that you didn't miss anything. So we keep on moving. I'm not seeing any as of yet, which is a good thing for this dog. Alright, now actually right here I'm coming across one microfilariae right here. It's the only one that I've seen thus far right in the middle of my screen. So it's actually pretty hard to see the parasite itself. You can just kind of see it under those red blood cells, and it's just kind of squiggling all around like a little snake. And so, so far I've just come across this one. I'm going to keep hunting just to see if I see any more for the entire rest of the slide. And like I said, we do know that this is already a heartworm positive dog who's in the middle of his aminoside treatment. That's why he's here today. And here's another one as well. Alright, coming across some more. Our last way up.
Can I get a PMOP up front? Can I get a PMOP up front?
Alright, so that looks like that's about it. So I did see those two microfilariae on our direct smear heartworm check, so I have to make sure I inform my doctor that I definitely still see those. And that is how you check for microfilariae.